Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, I'm Aina Nafisah Binti Ismail, together with my true friends Aliah, Atikah, Binti Yussoff and Grolina Voo Yee Tsu. Today we are going to talk and explain about our field report, which is about the knowledge of traditional Malay of Flora in treating hypertension. Okay, next I want to tell you about the objective of the fieldwork. We got two objectives of this fieldwork. First is to study the ethno-medicinal knowledge of traditional Malay by age group in city and the village areas for treating hypertension. And the second, to study the plant utilizations by traditional Malay in the treatment of hypertension. Next, I will explain about the methodology in our fieldwork. The study is conducted in USM Penang, Kampung Jalan Sepakat and Kampung Suluk at Teluk Kumbar, and also Kampung Pulau Betong at Balik Pulau. We use two methods in this study, which is by questionnaire in Google form and also direct interview with the informant. We have 130 participants that answer the questionnaire by a Google form. For direct interview, we have total 4 informants were randomly selected at the Teluk Kumbar and Balik Pulau villages.
The data obtained shows group age below 29 years old has well-versed knowledge with 90% in total, while group age above 30 years old is 81% in total. This result contrary with findings from research done by Sophie et al. In 2004, which states that the elderly have more knowledge in utilizing flora in treating ailments compared to the younger group age. In spite of that, the limited sample size may have influenced the different results in knowledge of traditional Malay. As for the practices in treating hypertension, these are few practices done by traditional Malay. Drink fresh coconut water became the most favorite with 13.1% due to easy access to get coconuts. Besides, coconut water is rich in potassium, magnesium, calcium, and vitamin C, which have a good effect in lowering blood pressure as per stated by Stiavati Krishnakuti in 2002. The second most favorable practices are consuming olive oil and lime or calamansi water consumption with 12.5% respectively. According to Aslani and et al. In 2016, lime or citrus essence contains limonene, citral, and linalool, which possess antioxidant activity, helps in prevention of LDL oxidation, forming plaque in arterial wall, thus helps in hypertension and cardiovascular disease prevention. Eating garlic is the third most favorable practice done by traditional Malay in treating hypertension with a total of 11.4%. Based on one et al. Study in 2015, the results show that consuming garlic significantly reduces blood pressure.
Informant 1. 65 years old Malay female live in Kampung Jalan Sepakat, have hypertension for 6 years and on prescribed medication. She believed to practice eating bitter melon, noni sprout, kartom leaf and goat crowns. She also said that there are differences in blood pressure reading after consuming the herbs. Informant 2. 76 years old Malay male live in Kampung Suluk. He is healthy and free from any disease. He believed to practice eating berry tuna, rice moss, sprout and fruit, neem tree sprout, noni sprout and god's crown. Due to this diet, he has no disease at 76 years old and healthy. Informant 3. 79 years old Malay male live in Kampung Pulau Betong. He is healthy and free from any disease. He believed to practice neem tree sprout, fern shoot, Cantella asiatica, bitter melon, god's crown and kratom leaf. Due to traditional Malay practice since ancestor, the informant is healthy and free from any disease. Informant 4. 77 years old Malay male live in Kampung Pulau Betong. The informant has a borderline hypertension and is not on prescribed medication. The informant does not believe to depend on traditional Malay only, but to have a better lifestyle and healthy diet. He also said that usage of kratom leaf and god's crown can help to treat hypertension. Based on the interview result, all the 4 informants confirmed that god's crown helped to treat hypertension. God's crown contained acid that enhance the vasorelaxant activity and inhibit non-adrenaline-induced contraction, causing second messenger to increase, thus reducing the blood pressure and helping in cardiovascular disease. 3 out of 4 informants believe kratom leaf by decoction method help in treating the hypertension, although kratom leaf are illegal in Malaysia. 3 out of 4 informants believe that bitter melon also help in hypertension disease. The bitter melon extract are reported to have free scavenging effect and antioxidant characteristics that are mainly attributed to phenolic compound. In conclusion, the ethno-medicinal knowledge of traditional Malay in city and village areas in treating hypertension has changed over the years as younger people also have knowledge of TM and older people remain practicing in their daily life. The most common plant utilized by traditional Malay in the treatment of hypertension are god's crown, bitter melon, garlic, lime, and citrus, as there is research to prove by the clinical result. There is more practice such as kratom leaf, but due to lack of research and illegal in Malaysia, require more further studies to investigate the dosage and toxicological information of the kratom leaf.